This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about meniscus tears on an MRI. What does it mean? If you like this video, we put out new content weekly, so please like and subscribe. So the menisci, you have two in each knee, one on the inside, one on the outside. They act as shock absorbers for the knee because the femur is kind of curved and like the tibia is slightly cupped. I mean, these are very slight, and the meniscus kind of acts to make sure that there's good contact between the two. And they kind of expand when they get pushed on. Anyways, so some people will have pain in their knee and they end up getting an MRI and it shows a meniscus tear. So what does it mean? First of all, it's important to know where you have pain. So meniscal pain is usually on sort of the outside of the knee. You might have clicking or popping, or you might have injured it when you were doing some sort of twisting injury, and then there's a tear in that meniscus. So sometimes for some people, they had a perfectly healthy meniscus, you get an MRI and there's a big tear there, and they have pain on exam and like guess that your meniscus is really torn, and you can try physical therapy, and if that doesn't really work, then you do surgery where basically you clean up the meniscus, you cut away the part that's torn, or if it's torn very substantially, you can repair it back down. The reason why you don't always repair it back down is because if it's just on the periphery, it's not going to heal. The sutures will be in there and it won't heal, and people do poorly. So usually for most people, they just trim it away. So yeah, if you have like a major tear sort of in the front, it's called the anterior horn, or in the middle of the body, and you have the symptoms that line up on physical exam, then it's probably a real tear and needs to be treated. But then a lot of people, especially as they get older, they get an MRI of their knee and it will show a posterior horn medial meniscus tear. What does that mean? That means the medial meniscus on the inside of the knee, all the way to the back, there's a tear there. And a lot of times when people start getting degenerative conditions in their knee, like arthritis and things as they get older, you'll find that tear there almost always. That's less of an acute tear in a younger person where it's like, yes, that's definitely causing you the problems, and it's more plus minus. So with some people that's symptomatic, they'll get it scoped and cleaned up and they feel better. Other people it's not, they'll get it scoped and cleaned up and they still have pain. So if there's arthritis in the rest of the knee and there's a meniscal tear there and it's in that specific location, again, the medial meniscus posterior horn, usually I don't pay too much attention to it because it's just part of the rest of the degenerative nature of the knee, and it's usually not worth it. Usually just try a steroid injection that usually calms it down. So to sum up, if you have a meniscus tear on MRI, if it's in the front part or the middle part, the anterior horn of the body, and you have pain like on the sides of your knees and it's locking and catching and you hurt it while twisting, it probably needs to be taken care of. If it's in the posterior horn of the medial meniscus and you have arthritis in the knee, then probably not. You probably get by with a steroid injection and some physical therapy. And then there's also lots of things in between. So I hope I was able to answer your questions about a meniscus tear on an MRI. What does it mean? If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below, but I really can't give you medical advice about your specific condition because this video and all my videos are for educational purposes only. Thanks for watching.